If you were to go beyond, let's say, a patient who obviously has high toxicity and probably would not benefit, do you think a healthy individual can benefit from these types of, I mean, I'm not going to say fad diets, but what is popular right now?
Our average diet is very close. It's too much protein loading and too much sugar loading. Mm-hmm. And so we talk about sick patients who come to us, and these patients, when we do the dark field here, for example, or when we do a blood analysis or protein electrophoresis, then we always find a hyperproteinization of the interstitial, of the tissue findings. So the tissue is hyperproteinized. Mm-hmm. That's why I tell the patients, come down from, the average patient takes 130 grams of protein per day, and we can only process about 40 to 60 grams. So we have overload. Come down with protein. How do you get down? No dairy protein and no beef. I say no red meat. Of course, you could still do ketogenic diet, which in a way is not bad, especially in cancer patients, but vegetarian ketogenic diet. This would be the trick. So I tell my patients, I'm like, John Wayne, I have one gun with 2 bullets and no dairy, no sugar. So these are my 2 first bullets. No sugar, no dairy. Then the average Western person is already much, much closer to how they should eat. And then by constitution, I do the little details. Sometimes I allow a little bit dried beef meat, for example, or very often I allow soft-boiled eggs, but not many. Mm-hmm. I sometimes allow, that's normally what I do, or sheep cheese in certain cases. So, but this is individualized. That's the fine tuning.
Yeah, everything has to be individualized, and people need to know their bodies, of course. We can't all say this is the best diet for everyone. That's a little bit preposterous, right? Now, for some, go ahead.
Sorry, when you see in my book, The Swiss Secret, I get patients, we sold this 50,000 times. This book was very often sold. And I get comments from patients who said, oh, finally, I lost 20 kilograms. Finally, I did everything before. But then I get other patients and said, oh, I was always underweight. And now I increased my weight by 3 kilograms. The same diet. Why? Because it equalizes, it harmonizes your metabolism. The elephant loses weight. The little transparent girl increases weight.
This is something I learned actually studying German biological medicine and alchemical medicine, even that if you give the proper type of ingredients, the proper remedies, it can do both. It can regulate you up or down. It's giving information to do it. So therefore, it isn't just stimulating or, basically reducing something. And that's how we should see even diet. As long as it's quality and it's good for us, it will either help us gain weight that would be healthy for us or reduce weight that would be healthy for us, correct?
Now, our diet is a metabolic harmonizer. This is what it is about.